Welcome to KS Medical Coding Academy. In this lesson, we will learn about EM prolonged services. We'll discuss time-based coding, physician time, prolonged service reporting, Captain Code 99417, Medicare HCPCS Code G2212, documentation requirements, and practical coding examples. This lesson will help you accurately report prolonged EM services in both CPC examinations and real-world medical coding. Before we begin, this training is for educational purposes only. Always refer to the latest CPT, ICD-10CM, HCPCS Level 2 manuals, payer policies, and official coding guidelines when assigning medical codes. In this lesson, we'll explore time-based EM coding and learn when total time can be used to select an evaluation and management service. We'll review which EM codes can and cannot be selected using time, discuss the activities that are included and excluded when calculating total physician or qualified healthcare professional time, and understand the documentation requirements. Finally, we'll define EM prolonged services, review the coding guidelines, and learn how to accurately select the appropriate prolonged service code based on total documented time. By the end of this lesson, you'll have a solid understanding of time-based EM coding and prolonged service reporting. Selecting the correct EM service level is based on one of two methods: medical decision-making, or MDM, and total time. For most office and outpatient EM services, the provider may choose the level based on either MDM or the total physician or qualified healthcare professional time spent on the date of the encounter. Most EM categories have 3 to 5 service levels, ranging from straightforward to high complexity. However, not every EM category follows the same rules. Certain services, such as critical care, use time-based reporting differently and have their own coding guidelines. Understanding when to use MDM and when to use time is the foundation of accurate EM coding. In this lesson, we'll review the guidelines for selecting an EM service based on total time. A provider may choose the service level using either medical decision-making or total time, depending on the documentation. Time-based coding is only available for EM codes that include time in their code descriptions. The time listed in the Captain Code is an average and allows for normal variations in patient care. If the provider spends more time than the highest level service requires, a prolonged service code may also be reported when the documentation supports it. It is also important to remember that Captain and Medicare use different time thresholds for prolonged services. CPT begins counting prolonged services after adding 15 minutes to the minimum time of the highest level code, while Medicare begins after adding 15 minutes to the maximum time of the highest level code. Understanding these differences helps ensure accurate code selection and proper reimbursement. In this slide, we will discuss additional guidelines for selecting an EM service based on total time. When time is used to determine the level of service, the provider must meet or exceed the time specified in the Captain Code descriptor. This total time is measured on the date of the encounter and includes only the activities that qualify under the Captain guidelines. However, emergency department EM services are different. ED visits are not selected based on total time because emergency care is often provided at varying levels of intensity while physicians care for multiple patients simultaneously. For example, Code 99221 may be selected using total time when at least 40 minutes are documented. In contrast, Code 99282 is an emergency department code and is selected based on the documented EM requirements rather than time. Understanding this distinction is essential for accurate EM coding. This slide explains additional rules for selecting EM services based on total time. First, when time is used for code selection, always use the time listed in the Captain Code descriptor. Remember that emergency department EM services are an exception because they are not selected based on time. These guidelines also require a face-to-face encounter between the physician or qualified healthcare professional and the patient, or the patient's family or caregiver when appropriate. Another important point is Code 99211. In office or other outpatient settings, if clinical staff provide the face-to-face service while the physician or qualified healthcare professional supervises the care, Code 99211 may be reported when all documentation requirements are met. Correct application of these guidelines helps ensure accurate EM code selection. This slide explains how total time is calculated for EM services. Total time includes all physician or qualified healthcare professional work performed on the date of the encounter. If the total time exceeds the highest level service and meets the required threshold, the appropriate prolonged service code may be reported. However, prolonged service codes are only used when the EM level is selected based on time. If the service level is determined by medical decision-making, prolonged service codes should not be reported. The provider must document the total encounter time in the medical record. Total time includes both face-to-face time with the patient or family and qualifying non-face-to-face activities personally performed by the physician or qualified healthcare professional. It also does not matter where the work is performed, whether in the office, hospital, or another approved location, as long as it occurs on the date of the encounter. Total time for EM services includes several activities personally performed by the physician or qualified healthcare professional on the date of the encounter. These activities begin before the face-to-face visit with preparation, such as reviewing test results and medical records. Total time also includes obtaining or reviewing additional patient history, performing the examination and evaluation, counseling the patient or family, and educating them about the treatment plan. Time spent ordering medications, laboratory tests, imaging studies, or procedures is also included. In addition, communicating with other healthcare professionals, documenting clinical information in the medical record, independently interpreting results that are not separately reported, explaining those results to the patient, and coordinating patient care are all counted toward total time. Remember that only activities personally performed by the physician or qualified healthcare professional on the date of the encounter are included in total EM time. Not every activity performed by the physician or qualified healthcare professional can be counted toward total EM time. Time spent performing procedures or other services that are billed separately must be excluded because those services are reported with their own captain codes. Travel time to and from the patient is also not counted as EM time. In addition, general teaching or educational activities that are not directly related to the care of a specific patient should not be included. Only patient-specific activities personally performed by the physician or qualified healthcare professional on the date of the encounter may be counted when selecting an EM service based on total time. In this section, we'll introduce prolonged services. An EM service may be selected using either medical decision-making or total time. Only EM codes that include time in their captain descriptors are eligible for time-based code selection. The listed time is an average and allows flexibility for normal clinical practice. When the physician or qualified healthcare professional spends time beyond the highest level EM service and all documentation requirements are met, a prolonged service code may also be reported. It is important to understand that Captain and Medicare apply different time thresholds. Under Captain guidelines, prolonged services begin after adding 15 minutes to the minimum time of the highest level service. Under Medicare, prolonged services begin after adding 15 minutes to the maximum time of the highest level service. Knowing these differences helps ensure accurate code selection and proper reimbursement. This slide explains prolonged services for office and outpatient EM visits. Medicare uses HCPCS code G2212, while commercial and other non-Medicare payers generally use Captain code 99417. Both codes are reported in 15-minute increments after the required time threshold is met. Always verify the payer's policy before selecting the prolonged service code. Different prolonged service codes apply depending on the place of service. Inpatient and observation services use G0316 for Medicare and 99,418 for non-Medicare payers. Nursing facility services use G0317 for Medicare and 99,418 for other payers. Home or residence visits use G0318 for Medicare and 99,417 for non-Medicare. Always select the add-on code based on both the payer and the service location. For consultation services, prolonged time is reported with CPT 99417 for outpatient consultations and 99,418 for inpatient consultations. When clinical staff provide prolonged services under direct physician supervision in the office, report CPT 99415 for the first 60 minutes and CPT 99416 for each additional 30 minutes. Some prolonged services are performed without direct patient contact, such as reviewing extensive records, coordinating care, or communicating with other healthcare professionals. For non-Medicare payers, CPT 99358 is reported for the first 60 minutes and CPT 99359 for each additional 30 minutes when all documentation requirements are met. These services must be medically necessary and meet CAPTAIN reporting guidelines. In this slide, we discuss Medicare prolonged outpatient services using HCPCS add-on code G2212. This code is reported only after the physician has exceeded the required time for the highest level office or outpatient EM service selected by total time. G2212 is reported for each additional 15 minutes and is commonly used with CAPTAIN codes 99205, 99215, and 99483. It should not be reported on the same date as prolonged service codes 99358, 99359, 99415, or 99416. Also remember that G2212 cannot be reported unless at least 15 additional minutes have been completed. Proper documentation of total physician or qualified healthcare professional time is essential. This slide explains CAPTAIN code 99417, which is the prolonged outpatient EM add-on code used for patients other than Medicare. Report 99417 only when the primary EM service has been selected using total physician or qualified healthcare professional time. 1 unit of 99417 represents each additional 15 minutes beyond the required time for the primary service and may be reported with or without direct patient contact. CAPTAIN 99417 is commonly reported with 99205, 99215, 99245, 99345, 99350, and 99483 when prolonged time requirements are met. It should not be reported with psychotherapy add-on codes or other prolonged service codes listed on the same date. Accurate documentation of total time is essential for correct coding. This slide covers HCPCS code G0316, the Medicare add-on code for prolonged inpatient or observation evaluation and management services. G0316 is used only when the primary inpatient or observation EM service has been selected based on total physician or qualified healthcare professional time on the date of the encounter. 1 unit of G0316 represents each additional 15 minutes beyond the required time. This add-on code is reported with 99223, 99233, and 99236 when the prolonged time requirements are met. It should not be reported on the same date as other prolonged service codes such as 99358, 99359, 99418, 99415, or 99416. Always ensure that the total time is accurately documented before assigning G0316. This slide explains CAPTAIN code 99418, the prolonged inpatient or observation EM add-on code used for patients other than Medicare. Report 99418 only when the primary EM service has been selected using total physician or qualified healthcare professional time on the date of the encounter. 1 unit of 99418 represents each additional 15 minutes beyond the required time. CAPTAIN 99418 may be reported with codes 99223, 99233, 99236, 99255, 99306, and 99310 when prolonged time requirements are met. However, it should not be reported on the same date as psychotherapy prolonged service codes 90833, 90836, 90838, or prolonged service codes 99358 and 99359. Accurate documentation of total time is essential before assigning CPT 99418. This slide explains HCPCS code G0317, the Medicare add-on code for prolonged nursing facility evaluation and management services. G0317 is reported only when the primary nursing facility EM service has been selected using total physician or qualified healthcare professional time on the date of the encounter. 1 unit of G0317 represents each additional 15 minutes beyond the required time. This add-on code is reported with 99306 for initial nursing facility care and 99310 for subsequent nursing facility care when the prolonged time requirements are met. G0317 should not be reported on the same date as prolonged service codes 99358, 99359, or 99418. Always ensure the total time is documented clearly before assigning this add-on code. This slide explains CPT Code 99418 for prolonged nursing facility evaluation and management services in patients other than Medicare. This add-on code is reported only when the primary nursing facility (EM) service has been selected using total physician or qualified healthcare professional time. Code 99418 is reported for each additional 15 minutes beyond the required time of the primary service. It is commonly used with 99306 for initial nursing facility care and 99310 for subsequent nursing facility care when prolonged service requirements are met. Do not report 99418 on the same date as psychotherapy prolonged service codes 90833, 90836, 90838, or prolonged service codes 99358 and 99359. Accurate documentation of total time is required before assigning this add-on code. This slide explains HCPCS code G0318, the Medicare add-on code for prolonged home or residence evaluation and management services. G0318 is reported only when the primary home or residence (EM) service has been selected using total physician or qualified healthcare professional time on the date of the encounter. 1 unit of G0318 represents each additional 15 minutes beyond the required time of the primary service. This code is reported with 99,345 for new patient home or residence visits and 99,350 for established patient visits when prolonged service requirements are met. G0318 should not be reported on the same date as prolonged service codes 99,358, 99,359, or 99,417. Accurate documentation of total physician or qualified healthcare professional time is essential for correct coding. This slide explains CPT Code 99417 for prolonged home or residence evaluation and management services used by patients other than Medicare. Report 99,417 only when the primary (EM) service has been selected using total physician or qualified healthcare professional time on the date of the encounter. 1 unit of 99,417 represents each additional 15 minutes beyond the required time. For home or residence services, CPT 99417 is commonly reported with 99,345 for new patient visits and 99,350 for established patient visits when prolonged time requirements are met. It may also be used with other eligible office and outpatient (EM) codes such as 99,205, 99,215, 99,245, and 99,483. Do not report 99,417 with psychotherapy prolonged service codes or other prolonged service codes listed on the same date. Always document total physician or qualified healthcare professional time to support code selection.